We do a variety of missions, from primary missions, which are sort of usually typically road vehicle accidents on the side of the road, but a large part of our work is also in inter-hospital transfers, where people are coming from smaller hospitals to the bigger centres to get a higher level of care. So yeah, certainly motor vehicle accidents make up a large part of our work, but also other things like farm accidents, work accidents, and falls from a height make up a large part of our work on the primary missions. And also we do some search and rescue missions as well too. I think that the work that we do with the inter-hospital transfers is really important to the people of Queensland. The majority of Queensland is a rural environment, and people are a long way away from really high levels of tertiary hospital care. So those patients who we transport 24 hours a day, 365 days a year, from these smaller hospitals to the larger centres with a wide variety of medical problems. That might be a medical issue, it may be a post-surgical problem, children, obstetrics care, all of those things that need to get to a higher level of tertiary care in the bigger centres. And they're really important, not just for those patients, but for their families.
Yeah, awesome.
So our critical care doctors are highly trained in both pre-hospital and inter-hospital transfers, and they work alongside the Queensland Ambulance Service paramedics and some of our own LifeFlight nurses as well. And they are able to go to scenes on the roadside to stabilise patients and to provide definitive care like they would in a tertiary hospital or a tertiary intensive care unit. Essentially, our doctors, paramedics and nurses carry pretty much a mobile intensive care unit where they can do lots of procedures, whether that's on the side of the road or within a small hospital, to stabilise patients and bring them to that higher level of care. So there is a big advantage to getting patients from the scene of an accident or from a small hospital where there may be limited resources, and getting them rapidly transferred to a larger centre where there is a higher level of care. And our feeling is that every Queenslander deserves that opportunity to be rapidly transferred to a world-class standard of care. A lot of the patients that we see in terms of either pre-hospital patients who are on the roadside or at an accident scene, or patients who are in a small hospital, there's a great advantage to moving these patients rapidly from those areas to a tertiary hospital in a big centre. And some of the things that have been shown is just improved time and access to things like operations or surgery, a reduced time in transport where patients typically get cold, they have more pain and they deteriorate en route. So if we can get those patients quickly from the scene of an accident to the hospital, that's a great advantage for them in their initial treatment and in their long-term recovery. So unfortunately, road traffic accidents do make up a large part of what we see, particularly in the pre-hospital environment. These accidents often have multiply injured patients, and it's a life-changing scenario for lots of people. Our job is to manage these patients on the side of the road and provide critical care interventions and to transport these patients to hospital for often life-saving surgery as quickly as we can. Obviously, these jobs have an impact not just on the patients, but also on their families and also on the crews that provide the care, both the first responders and the area medical crews as well. I think this is a big part of our work, and it's a critical part of what we do, and we are there for the people of Queensland every day of the year.
Yeah, awesome.
Yeah, our fleet of air ambulance jets provides an additional capability to LifeFlight with the helicopter assets as well. So these jets have the same capability in terms of medically. We have a critical care doctor who's highly trained with a critical care nurse also. These tend to go to sort of longer distance missions, so particularly the sort of missions that would take even a couple of hours flying time to get to, that's sort of just out of the range of the helicopter. Similarly, the majority of the work is inter-hospital transfers, so particularly coming from small hospitals and bringing those patients back to tertiary centres for an increased level of care, and particularly intensive care type patients and transfer.